and welcome to this edition of Health Matters. Today we will speak about the care of preterm babies in Goa. Our guest on this show is Dr. Ryan Dias, consultant neonatologist based in Margao. Dr. Ryan currently works in neonatal intensive care units in Margao and runs his clinic there as well. He is a member of St. Luke's Medical Guild. Dr. Ryan, thank you for joining us on the show today.
Good evening.
I just introduced you as a neonatologist, not as a child specialist. Could you tell me what your specialization entails?
Yes. Today's era of medicine is one of subspecialization. Yeah. So you have doctors who look after, for example, your heart, and they are called cardiologists. Yes. They look after your brain, and they are called neurologists. Yeah. Similarly, in pediatrics, or what we have known as child specialists, after their pediatric training, nowadays doctors would subspecialize. So you have groups of doctors that specialize in children's hearts. They're called pediatric cardiologists, pediatric neurologists. And in the field of neonatology is where these doctors would specialize looking after babies who have problems at birth. These might be preterm babies or term babies who have problems after birth. The field is neonatology, and the doctors that specialize are called neonatologists.
Okay, so you talked about preterm. We also know of the term as premature. So what is the meaning of premature, and when does one label a baby as being preterm?
Okay, so a normal pregnancy would go for an entire 9-month period. So you would have to complete 9 months of pregnancy. Right. Unfortunately, certain expectant mothers do not get an opportunity to complete that 9 months for whatever reasons. The pregnancy ends earlier than 9 months. So when a baby doesn't go for the 37 weeks onwards or the 9-month completion, these groups of babies are called premature babies. Now, obviously, you have premature babies that go almost to 9 months, right. So the 8 months, who are called the late preterms. Okay. And then you have babies who are born very early, babies who maybe complete just 6 months. So these are the 24, the 25, the 26 weeks, 27 weeks. So these have not completed even 6 to 7 months of pregnancy, and they are called the extreme premature babies. Okay. And in between you have your conventional preterm babies between 28 and 32 weeks, which are around 7.5 to 8 months.
Okay. Are there hospitals in Goa which can deal with the needs of these small babies?
Yes, actually, fortunately, there are hospitals. In most big cities in Goa, all the big cities, they have at least 1, if not 2 or 3 neonatal intensive care units. Okay. These have the facilities, the staff, as well as the equipment to look after these small babies. And at Goa Medical College, we even have the government-run neonatal intensive care unit where such babies could be looked after. So in answer to your question, yes, there are units scattered all over the state, about 5 or 6 in number totally, that could look after these babies.
Okay. So to start at the beginning of the life cycle, why do some women have preterm deliveries, and is it preventable at all?
Preventable, maybe not, because a lot of research has gone into this. Until today, no one has been able to prevent or completely avoid premature births. Okay. But the incidence of premature births can be reduced in a case-to-case basis with certain interventions, but cannot be completely eliminated. In fact, worldwide, 10 to 12% of all pregnancies would end in premature births. Okay. In India, which by the way has the highest incidence of premature births at this current point of time, the quoted incidence is as high as 22-23%. And statistically, 24% of all the premature births anywhere in the world are in India. The main causes, so to say, are women who conceive at an elderly age group, so beyond the ages of 35 and 40. Okay. I don't mean to be a labeling kind of guy, but that's what it is, because often assisted fertilization methods are used, right. And you have a high incidence of twins, triplets, and maybe even quadruplets, and these babies would sometimes not go the entire 9 months. You also have a higher incidence of maternal infections in India, which contributes to early premature labor. Then they talk about stress, whether that's physical stress in low socioeconomic groups or the mental stress that nowadays women face at work, pressure at home, whatever they may be, social issues. These could also be contributing to a higher incidence of prematurity. Rest assured though, it is not avoidable neither in the Western world nor in a developing country like India.
You said that at this point in time, India has the highest occurrence of premature deliveries in the world. Have we been lower on the scale at some point in time?
Statistics in India was quite slow to start. So we've only started to keep records, keep data more recently in the last few years.
Okay.
In the past, a lot of this may have been happening, but was not documented, was not recorded. Right. So it's difficult to compare in hindsight. Right. But the current data, what it shows is, speaks to this effect of what I just mentioned.
Okay. So what is the normal process that is followed if an expectant mother goes into preterm labor?
Okay. In 20% of cases of preterm labor, one actually gets time because the obstetrician would be able to anticipate that this pregnancy may not go 9 months and would lead to be terminated earlier, maybe 7, 8, whatever be it. So he would prepare the family for an early delivery. The neonatologist or the pediatrician who is attending birth would have time to plan for things. A discussion with the family may have been held where these different discussions about what will happen around birth, what will happen after birth, where will the baby be taken, who will be looking after the baby, what would be the course for this baby in the neonatal unit. These can often be discussed, but only in 20% of cases. And these are the ones where the mother is starting to get blood pressure problems, high blood sugars, diabetes, or for some reason antenatal checkups of the mother reveal that there is a problem to the growth of the fetus. And in these cases, that's just about 20% so to say, one can anticipate, one can discuss with the family, and one can put a process in place of what should happen. In the vast majority, the ladies just go into early labor, the babies come out quite soon, not allowing enough time for the family or for the doctors to actually have discussions, and the emphasis gets shifted on to stabilizing these premature babies, looking after them, transferring them to a place of safety, and then having discussions. So the processes really do vary, but the ultimate aim would be to get the baby to a unit where the baby's needs could be looked after.
So given that already the fact of having the baby preterm is a shock to most mothers on the system, on the whole family unit and everything, is it difficult for parents to then accept the fact that the baby needs to be away from her and them for an extended period of time by moving the child to an NICU?
I actually think it's very difficult for parents to accept this, because when you as a family have the good news of going to have a child, you don't actually plan for complications. You actually don't plan for your baby to come out early. You don't plan for your baby to be looked after by strangers, doctors you've never met before, nurses you've never met before, in a unit you've never visited before. You actually think your baby would be born and you'll take your baby home by the 3rd or the 4th day. So premature deliveries and premature babies are a shock to the family. Actually, I don't think anything can prepare them for such events. But hopefully with modern enhancement in what we do to these babies, they see hope, they get comfort, and hopefully they don't feel so anxious. In those 20% births that I mentioned earlier, actually they are probably the group of preterm parents who may be prepared in a way.
True.
But the vast majority, they're like rabbits in a headlight. It's very stressful, and often you can see on the first few days they're in a state of shock, and reality slowly sets in.
Okay. So once the baby has been moved to an NICU, what happens once the baby is admitted? What do doctors and staff do to help the baby?
Yeah. The important thing here would be to understand, I spoke in the beginning about 6 months premature, 7 months premature, 8 months and 9 months. The needs of these babies are different. So an 8 and an 8.5 month baby, the needs might not be as much as the needs of a 6 or a 7-month baby. So each case on its own merit needs to be gauged, needs to be assessed, and a plan on what needs to be done happens after that assessment. Even in an 8-month or a 7-month, different babies behave differently. So we normally have protocols or guidelines, certain standard monitoring that needs to happen, certain standard assessments that need to happen, certain clinical judgments are made based on those assessments, and these babies are then supported as far as their needs go. So it's really on a case-to-case basis, but with modern equipment, blood testing, we can assess the needs of these babies and then put in place kind of a plan on what needs to happen next.
So given that these babies are obviously born earlier than is normal, what are some of the major problems or kinds of problems that they could face?
I'll really take a few minutes to explain this in detail because I think this is what most parents would like to know once babies are born early. So nature intended for a baby to be born at 9 months, to come out breathing, to then feed, to move around, sleep, and do all those things. Nature never intended for a baby born at 6 or 7 months to come out breathing, feeding, maintaining its temperature, maintaining its blood sugar. So very often the problems that we have to tackle are basically because of an immaturity of these organs.
Right.
So let's take a couple of the main organs. The lungs. A baby was not meant to breathe till 9 months. So the lungs are lacking behind in their development. And then you have this baby who's forced out into the world who now has to breathe. And often the lungs just can't manage. So the doctors for the extremely premature babies would use a breathing machine to assist these babies' breathing, use certain medicines to help these babies' lungs cope with living independently. The baby who's born perhaps at 8 or 9 months, that baby's lungs may be fairly mature and may get away just with a little bit of oxygen or may not need support either. When it comes to the heart, the blood pressure needs to be maintained by the small baby's heart. So we need to make sure that that organ's working well. When it comes to infection, which actually is one of the main reasons these babies have problems, their immune system is just not developed, and even the most trivial of infections that can be picked up can make these babies very poorly or very sick. So they are often monitored closely for infections. The use of antibiotics and regular screening tests is quite part of the job that we do daily. I could go on with each organ, but actually these are the main ones, along with the last important organ is your brain. Because remember, the brain is developing. It's undergoing a rapid stage of development inside the womb, and suddenly it's pushed, the baby's pushed into this noisy environment, into the real world, so to say, and it has to mature quite fast. And the brain is quite delicate at this stage. So sometimes we see problems later on because these premature babies haven't had that normal 9 months of sleeping and growing that other babies have had an opportunity to undergo.
Okay, so I'll come back to that point. But while we're on the point of admission and help that a child receives in the NICU, on an average, how long does a baby stay in the NICU?
Again, that varies depending on what gestation the baby was born.
Okay.
So for example, a baby who is born at 8 months might stay for 10 days, 15 days, and might be able to cope well with discharge. A baby, on the other hand, who's born at 6 months may need to stay 2.5 to 3 months in hospital. So we are talking about 80 days, 90 days in hospital, each on its own merit, obviously. But on an average, if you were to ask me, an extremely preterm baby, we prepare them for 2 to 3 months in NICU, and a late preterm anywhere from 1 to 2 weeks in hospital.
Okay. When do you decide, or how do you decide after how many weeks or months, or signs that you see in a baby, for example, that the baby is ready to go home?
Actually, at that point, it's not just what the doctor feels, but it's also feedback from the nurses and the mother that helps us decide. So if you think about it, for a baby to go home, a baby needs to be able to feed, A baby needs to be able to maintain its own temperature. A baby needs to manage having a normal blood sugar, and a baby should be free of infections or medical problems.
Right.
So, towards the end of the NICU stay, one is gauging for these things on a daily basis: readiness for feeding, completing feeds, gaining weight, maintaining body temperature without a warmer or an incubator, and the comfort that the mother would have with these babies. Once the staff and the doctor feel the baby is ready for discharge, is doing everything right, we then do what is called as a rooming in period, where this baby and the mother are kept in the hospital but in a private room, where she looks after the baby on her own.
Okay.
If she needs help, she can just buzz, and one of the neonatal girls or the staff would be there to help her. If she completes that period for 1 or 2 days and she feels reasonably confident, at that point we consider discharge and then follow up these babies in the outpatient department.
Maybe for a bit of a pleasant memory, what's the smallest baby that you have had in your care go home?
So in the United Kingdom, at University College London, we had 480-gram twins at 24 weeks. It was a lot of hard work, it was a lot of team effort. In Goa, the smallest baby that I have sent home is 590 grams. It does evoke strong emotions, because it was a big challenge, and with the grace of God we managed to get that baby home. One of the things I'd really like to say at this point is weight is not the only criteria. You have a combination of gestation, or the weeks or the months of the baby, and the weight. So sometimes we have babies who are quite small, 600, 700 grams, but they are a little more mature, as in they have already completed 7 months. They are not growing so well inside their womb, that's why the weight is small. These babies tend to do a little better than the more premature babies at 6 months who may weigh more. So weight is not the only criteria, but yeah, that was just to answer your question.
Okay. I don't know if my next question is fair or sensitive, but do all babies that have been admitted into the NICU actually get discharged? Is there a percentage?
The honest answer is no. All babies admitted to the NICU do not make it home, because many of these babies are just too fragile, too small. They have infections which make it very difficult to treat these babies. And some of these babies, their lungs are just so immature that even with modern advancement of machines and medicines, the lungs just can't make it. So in terms of the premature babies, mortality is a thing we deal with very often. It is very difficult to deal with it, but it's something that, like any intensive care branch, the mortality rate is something that we are well aware of, and we discuss with parents, and it's always on our mind, because not all babies do make it home. Obviously, in the extremely premature group, the 26, the 27, the 28 weekers, the babies that have just completed 6 months, the mortality rate is far higher as compared to the late preterms. That's the 32 weeks, those who've touched 8 months, 8.5 months. Normally that group, the mortality rate is much lower.
Okay.
Does that answer your question?
It does. It does. I don't know if there is a statistic around
You
it.
see, the statistics worldwide, there are statistics. They don't really apply to India, because in India it's a different ball game, where infections are the primary cause of mortality in these babies. And one would say that a baby born less than 27 weeks has about a 50 or 60% chance of survival in India. Abroad, the chances may be 5-10% or 20% higher, but in India, the extremely premature babies, on an average, we prepare parents for dire straits, really.
How do families deal with it?
As I said earlier, having an extremely premature baby is difficult. But what we normally tell parents is the first 3 days and the first week beyond the 3 days, those are the most critical periods. If the baby has a more stable first week, the chances of survival increase dramatically. And parents are well aware of this, quoted figures of 3 days, 7 days, and their hopes increase on each given day. I feel most bad for babies where they go on to have a good few 1 month or so and then pick up a very nasty infection and then don't make it. It's a big disaster both for the staff, the doctor and the families most of all, who find that very difficult to take. And I don't think there's any way to make it easier on them, but it is difficult, yeah.
Maybe for something a little more pleasant, for those that actually make it home, are they then completely like full-term babies? Do they still need extra care, or are they good to run as a mom would normally look after her baby?
I think that's an interesting question, and I think the answer to that is really on what was the gestation at birth and what was the course in the neonatal unit. So for example, a late preterm baby, in the past actually we told these parents the babies will be completely fine, there will be no problems. But more recent evidence in the last 5 years has shown that these babies need more attention at homes because they have growth problems, they have difficulties putting on weight, and they need attention to improve and watch out for developmental problems. Although they may not be severe, they are mild. But with the extremely premature babies, these are the babies that need to be closely observed. With early intervention, good feeding, avoiding infections, these babies can actually lead a good quality of life. And it can vary on a case-to-case basis. You always hear about the miracle baby that is completely fine, and then you hear about the baby that has some problems but not a huge problem. And then of course there is a minority, a few babies who actually are having severe problems with their development and need to be cared for around the clock. And I think it's not one size fits all. It's each baby on its own needs to be assessed for that risk.
So can babies who are born premature grow up to be just like other full-term babies, children, and I'm talking past the infancy stage, but school-going children, do they lead? I hesitate to use the term normal, but for lack of a better word, I will. Can they lead completely normal lives? Are there issues with development, either physically, emotionally, mentally, in any form?
Do you know Winston Churchill was born premature?
I didn't know that.
And he led a nation. Okay, so it's not all doom and gloom.
Okay.
Some premature babies actually do well, and with motivated parents and developmental assessment and early intervention, these babies actually can do so well. So when parents ask me, doctor, what are the immediate long-term things that I need to worry about today? One of the things that comes to mind is short attention spans, concentration difficulties, sometimes refractive errors, sometimes some loss of hearing of certain frequencies. But we check for all of these things. Vision, hearing, these are all assessed. So these are the common things. Now, in a few patients, it's their muscles and their nerves that are a bit weaker or stiffer, whatever way you want to call it. And with therapy, this can be improved. The first 2 years are probably the most challenging. When I follow up these babies in clinic, they have repeated infections. They seem to fall sick faster than other babies because their lungs are a bit immature. Their immune systems are still maturing. But as time goes by, they seem to get better. And if you follow up these children long term with early intervention and the support of motivated parents, they actually can do quite well.
Okay, well, that's good to know for parents who might worry about that.
I think it's important to understand, just because X had a baby that was severely disabled, that doesn't mean Y will land up in the same scenario. So vice versa, on a case-to-case basis, a doctor would be able to study the case and be able to prognosticate what would be the level of expected outcome.
Now, for those babies that have had a prolonged hospital stay or an NICU stay, Are there prohibitive financial implications?
That's an interesting one, because see, for a baby who spends 1 to 2 weeks, it may not be a major amount of financial burden. But if a baby spends 80, 90 days in hospitals, costs are accumulative. Even a simple cost of nursing charges or doctor's consultation visits over 90 days, that's additive. So for an extremely premature baby, or for a baby that spends 2-3 months, the cost can be very prohibitive in certain cases. Now, the machines that are used are very expensive. The medicines often which are required are either expensive, or they are procured from foreign nations, so there are a lot of costs to these medicines, and these are just additive on their bills. You have insurance, the government insurance, which helps some of these parents, and you also have private insurance companies, and most NICUs in Goa are covered under the private insurance company. So we often have parents who have insurance cover. We have parents who have the government Din Dayal scheme, and they avail of that facility, because all NICUs in Goa are currently, at least all the top 4 or 5 in Goa, are covered by the Din Dayal scheme. And one must not forget, we have a tertiary neonatal unit at Goa Medical College, which does not charge these patients to have their babies there, and that is available to parents who may have financial difficulties. So I think in today's day and age, finance alone should not be a barrier to the care of these babies.
Okay. My next question, Dr. Ryan, is are you seeing a rise in the numbers or the percentages of premature birth? I know you gave a statistic earlier in this interview. I also know that the fact of premature babies has not been a rarity. It's been something that we've been hearing about, for a long, long time. But we've also heard or read about recent celebrity baby births that have been premature, where they're talking about Karan Johar's twins or David Silva's child, which then brings attention to the occurrence, kind of focuses world attention on the fact that, oh, it can happen to anybody. But is that actually indicative of a rise that you are seeing?
I think that it's twofold. I think there is a rise in premature births, but it is also that we're getting better at sending these babies home. Whether they be twins, triplets, and maybe even quadruplets, these babies are going home. So they're getting attention now. Maybe 20 years ago, many of these premature babies would not have made it home. But now the fact that they go home, they get a lot of publicity. So it's twinfold. Right? That's what my impression is.
Okay. So then I'd like to talk a little bit about things that go into making this happen, right? You've worked in the neonatal care space across the West as well as in India. Are you satisfied with the infrastructure that you see in Goa? Do you think that there is something more that is needed? Do you think there is something that should change? But also, this could be across any area. It could be equipment, it could be nursing care, it could be transportation, logistics, whatever you might have seen.
See, in terms of equipment, I think any equipment available in the West can be bought in India now. So it's not the equipment. Second, coming to infrastructure. We are getting better because this field is progressing, things are changing, and in Goa particularly in the last 15 years, we've got a lot better at doing this. Transporting the babies from maternity units where they are born in an emergency scenario to the neonatal care units, that is something that nowadays everyone is focusing more on transporting these babies with more stability, with more safety, avoiding complications en route. So this is what we need to focus on. Second, the doctors, the nursing staff, the multidisciplinary teams that we work with, they all need to update their information, their understanding, their knowledge and their skills, because what was 5 years ago actually gets outdated. So the practice of neonatology keeps changing every 2 to 3 years at least, to be realistic, because new research comes in play. The way we practiced 5 years ago is no longer the way we practice. I'm talking about in certain aspects. We're getting better at what we are doing. So education both of the nursing team, the junior, the senior doctors, as well as the multidisciplinary team working together cohesively is improving. And as well, the obstetricians who are looking after these mothers are doing their jobs more effectively now because they are able to predict in those 20% of babies that actually benefit by coming out earlier rather than having prolonged pregnancies where they are actually not thriving inside their mother's wombs. So things are improving, infrastructure is slowly getting better, but like any field, and India being a developing country, we are developing in this field as well.
You just talked about multidisciplinary teams. So does neonatology as a specialization, do you in particular work across different kinds of specialties? Could you talk a little bit more about that cohesion?
So besides the nursing members of team, which are probably very fundamental to running a good NICU, are the therapists like the ophthalmologists who often visit premature babies to look at their eyes, because there's a condition called retinopathy of prematurity which affects premature babies. So getting them screened for that after a couple of weeks is important. We have the audiologists and the speech and language therapists who assess their hearing. We also have other therapists like physiotherapists and occupational therapists, and probably post-discharge their role is very important. If one takes the example of the neuro rehab clinic at GMC that aims to assess and provide care for these babies after birth, identifying those with developmental difficulties, that's the one that's most heard of. But there are clinics like these, private physiotherapists, occupational therapists who are doing this in their own capacity in the big cities in Goa, who are also part of this MDT, and their work is integral to the success of these babies.
Interesting. It's really a collective effort sending a baby home.
I think it is.
What are some of the challenges that doctors in your field face?
So first of all is the work challenge, because often these premature babies occur at odd hours, middle of the night, early mornings. The lady just suddenly goes into premature labor, and then the doctors have to stabilize these babies, transfer them to NICUs and look after them. So the work involves odd hours, not just for me, but for any doctor in this specialty or in intensive care really. And then comes, obviously we have our own families, our children, and we need to spend time there. So trying to balance that is difficult. And at the same time, giving our bodies both physical and mental rest to make sure we do a good job. I think that's one of the major challenges, besides keeping up to date with our knowledge, which is constantly changing. I think these are the main challenges.
Okay. Now obviously we've talked a lot about the subject, and we've talked a little bit about the neonatal intensive care units. Now, if a patient or a parent or a third party is seeking information about NICUs, their services, contact information, etc., is there somewhere that they can go to a website, a counseling center, a one-stop shop for information?
See, in Goa, we don't actually have a one-stop shop. I've tried Googling this many times, and actually we don't have a one-stop website for most parents. Internationally, there are various support groups for these parents, and the knowledge would be relevant to them in terms of what to expect, what normally happens, what can they do to help good outcomes, etc. But nationally, you have a Premature Baby Foundation with some information and some links. I have toyed with the idea of actually setting up a website, just a broad-based website, to try and help people understand what neonatal cares are, what actually happens, and who are the therapists in their cities who may be able to help them when they need follow-up care. Obviously, they are pediatricians who are looking after them, or they are neonatologists. They are the best people for the families to get in touch with, and they should be able to put them in touch with various therapists or various facilities that are there for them to avail of.
Okay. To anybody who has had a premature baby, Dr. Ryan, do you have a message for them?
First of all, I would like to salute the mothers of most of these premature babies, because I don't think it has been easy for these families or these babies. They have been through quite a lot and they've put in a lot of effort. So firstly, let me salute you. The second would be to say is that today you should engage with your pediatrician or your neonatologist or your child specialist to ensure that your child has regular follow-up, and your doctor would check for growth, would check for developmental problems, if any red flag signs, so that early intervention could be done using various therapists who are already available in Goa to improve the development and the outcomes of these babies. Things do get better. The first 2 years will be very challenging, but as the child grows older, the child's needs, especially medical needs, reduce. You will be able to see a much better outcome or a much better quality of life for your child. So please remain hopeful, please remain engaged, and keep doing the good work which you are doing, which is spend all that time with your child, encouraging the child's development.
Thank you, Doctor. That, dear viewers, was a really wide and in-depth session into the subject of caring for preterm babies. If you know of people who might benefit from this information, do share it or enable them to watch our segment on YouTube. Thank you, Dr. Ryan, for your time and for the truly informative insights that you've shared today.
To you and your viewers.
We hope that the occasion of the birth of a child, which is one that brings you joy, can continue to be so with the best possible care at the most critical of times.